Well, good morning, everyone, and thank you for being here today. Just a few quick housekeeping items before we get started. I'll kick it over to John Carl. I'm Ben Shakin with the Connecticut Community Nonprofit Alliance, and John Carl will introduce everyone else. We're very happy you could all be here. There's over 200 people registered for this morning's forum from Connecticut, Massachusetts, and Rhode Island, including over 40 legislators from all three states. So we're very happy that everyone can be here today. We have started the recording on the webinar today. It will be recorded. The recording will be available to folks after today as well. We'll also answer questions and after the panel is concluded, which we expect to take around the first hour or so of today, and we'll have opportunities for folks to speak, to ask questions, to share their own experiences who are attending the webinar today. Questions and comments can be shared in the chat box or by submitting a question to the panelists. And if time permits, we will promote you to become a panelist, and you can ask the question yourself rather than having us read it again after the panel. So I think with that, please feel free to put any questions to me in the chat or to or as a question and answer in the Q&A section, and I will kick it over to John Carl Casa, our president and CEO, to begin.
Good morning, everybody. Thank you for participating here today. We really appreciate it, and the numbers that we have today, I think, shows how important this issue has become to everybody throughout the Southern New England region. We wanted today to discuss the workforce crisis that's facing all of us, as well as possible solutions, both individual to the states that are here today, but also for all of us as a group. The Connecticut Community Nonprofit Alliance is holding this together with our colleagues at the Massachusetts Providers Council and the Community Provider Network of Rhode Island. And I want to thank the CEOs, Michael Weeks and Tina Spears, and their staffs for their help in putting this together this week. It's been terrific to work with them. In a national survey done by the National Council on Mental Wellness, 97% of behavioral health organizations say that it's difficult to recruit right now. And that's in the context in which they also say 78% of organizations are saying demand has increased. The ACOR, which represents providers of services for folks with intellectual and developmental disabilities, said that 92.5% of their organizations are having trouble doing recruitment. This is a national problem, and the quality of life in each of our states is dependent on us solving the problem. Nonprofits, as you know, they serve people in need. They employ hundreds of and literally hundreds of thousands of people in the tri-state area. In Connecticut alone, 117,000 people work for nonprofits. They support people with intellectual and developmental disabilities. They treat people with behavioral health needs. They feed the hungry, house the homeless, and provide the kind of arts and cultural offerings that make this region such a great place to live and to do business. But they are, as we know, in crisis. Years of underfunding, followed by COVID, have combined to exacerbate the challenges that they face under normal situations. People are finding that they can be paid more if they want to go work elsewhere, and they are going. It caused stunningly high vacancy rates, and that means less access for people in need. It means closures of programs, means freezing admissions. Nonprofits are dependent by and large on contracts with state government. They can't raise prices. They can't increase their own reimbursement to retain and attract workers. And without workers, the people who depend on services, our family members, our friends, our neighbors, they're at risk. And it's really just that simple. In Connecticut, addressing the workforce crisis is a top legislative priority for the Alliance. And a key part of that is the state continuing toward the goal of increasing funding to nonprofits by $461 million over a 5-year period. What we'll do today is we'll begin with panels first from Massachusetts, then Connecticut and Rhode Island. We'll hold questions and answers until the end. That way we give each panel an opportunity to, the same opportunity to discuss the issues that their state faces. The first speaker today is my colleague from the Massachusetts Provider Council, Michael Weeks. And Michael, I will turn it over to you.
Well, good morning, everyone. And it's good to see all of these wonderful advocates and folks who are supporters of the human services sector. First, I want to apologize because I'm also doing another hearing we're having at the legislature. So if I'm not here for the entire piece, do know that we've got Bill Jelinek is going to be here, and we've also have members of our board who are going to be participating in this as well. So I'm looking forward to have a really invigorating discussion about the workforce crisis. So thank you, John Carl, for the introduction. As John Carl noted, my name is Michael Weeks, and I'm President and CEO of the Providers Council. It's Massachusetts' largest association of home and community-based human services organizations. And like our neighbors in Connecticut and Rhode Island, Massachusetts is facing a shortage of workers in many industries. Perhaps in no sector is the situation as dire as it is in human services. The human services sector in Massachusetts protects women and children, provides support for our older residents, helps individuals with intellectual and developmental disabilities, assists those with an opiate or alcohol addiction, and creates for our veterans and others needing help and protection and support. All told, the human services sector provides essential care to 1 in 10 Massachusetts residents. Our workforce, which continued working in person during the pandemic and did not have the opportunity to work remotely, includes over 180,000 jobs throughout the Commonwealth just in the human services sector. It's making us one of the largest employers in the state. But unfortunately, it's become increasingly difficult to recruit professionals in the community-based human services sector and retain the staff members that our sector does have. These are often complex and demanding jobs, and the median rate of reimbursement proposed by Massachusetts is just $16.79 an hour to serve our children, families, and other people in need. I emphasize this is the proposed median, which means half of our professionals, regardless of the years of experience or educational levels, are making less than $16.79 an hour. Now, while our chief competitor for talent was state government and the health and hospital industries, we're now losing them to grocery and retail stores, both of which can offer higher rates of pay for all their employees. This fall, Costco announced starting wages at $17 an hour to start, while Amazon announced starting wages of $18 an hour. Unfortunately, with the state only benchmarking our direct service salaries to a median of $16.79 an hour, that's a position where we just cannot compete. Additionally, our sector pays less than the living wage, as the well-respected MIT living wage calculator determines that the living wage for a single person in the Boston area is $17.74 an hour. And if they even have one child, as many of our workers do, that amount increases to $36.88 an hour. Furthermore, in terms of consequences, if Amazon has staff vacancies, packages may take an extra day to arrive. If Costco has staff vacancies, lines may be a little longer at the cash register. But if a community-based human service provider has vacancies, well, the consequences are much more dire. It means that residents of Massachusetts who need critical care from this essential sector instead find themselves stuck on waiting lists, unable to receive assistance. And for programs, it means that they cannot help as many clients as they may otherwise be able to. In some instances, we know that programs have long waiting lists and others are closed entirely or are unable to open because of the inability to hire qualified staff. The pay gap is even more pronounced when you look at our community-based sector to state human services jobs. According to recent state wage and employment data, The state pays its own employees in the individual and family services area an average weekly wage of $1,274, while the community-based human services sector, which has its wages benchmarked by the state government, can only afford to pay employees doing similar work an average wage of $548. This is a pay gap of more than 130%, an insurmountable challenge for us to recruit and retain a high quality workforce. Now, I asked two of our members to tell you a little bit more about the issues they're facing in Massachusetts. I've given you some global numbers and statistics. Diane Gould of Advocates in Framingham will discuss the impact of vacancies have had on her organizations and the clients and the people they serve. And Chris White of Road of Responsibility in Marshfield can discuss how the workforce crisis is impacting his organization. But before I turn it over to them, I will briefly mention two bills on which the Provider Council is working that could make a difference in our field. One is our Fair Pay for Comparable Work bill. Would eliminate the pay disparity between state workers and community-based human services workers who have similar jobs. And our student loan repayment legislation would allow full-time human service workers earning $50,000 and less annually to receive up to $150 a month for a period of 48 months to help pay back student loans. We provided testimony on our Fair Pay for Comparable Work bill last month and it was well received. We're planning to also present testimony today at this very moment, in fact, on our student loan repayment legislation, but rather than advocate for loan repayment and present some borrowers from our sector who would qualify, we're in the grateful position today to thank the legislature for its historic investment in human services through a loan repayment fund being created for that body. Earlier this year, we asked the legislature to use some of the American Rescue Plan Act, ARPA funding the state received to create a loan repayment program to help community-based human services workers. And last Wednesday, they released a conference committee proposal that will spend $16.5 million creating a loan repayment program and allocated another $13.5 million to a grant program to help human service organizations recruit and retain qualified workers. As of last Friday, the legislation was passed by both the House and the Senate. It's now sitting on Governor Charlie Baker's desk for his signature. And we are optimistic that he will sign and make this happen. And we wanted to also thank our legislators, some who are here today, for their support in making this happen. So I want to thank you for the opportunity to speak today on this matter. I know I've given you lots of data and numbers, sort of an overview of the situation here in Massachusetts. I'd now like to turn it over to Diane and Chris. And we look forward to sharing our story today and hearing from all of you as well and discuss how we might be able together collaborate on these important issues. So thank you.
All right. Thank you, Michael. And thank you for having us here today. My name is Chris White. I'm the president and CEO of an organization called Road to Responsibility. We're a large adult service provider for adults with intellectual and developmental disabilities, providing homes, jobs, and therapeutic day supports throughout the South Shore and southeastern Massachusetts. And this has been a brutal stretch for folks. Just to give you an idea, looking at data from March 1st, 2020 through November 30th, 2021, we've experienced a 52.9% turnover rate, which when I first saw that number, it nearly dropped me out of my seat. But that's been the reality around here. We currently have 225 total vacancies, comprised of 179 full-time positions and 46 relief positions. To put that into context, our turnover rate in February of 2020 was only 19%, and our growth rate currently is minus 13.7%, whereas in February 2020 it was plus 1.2%. So just ugly numbers all around. At our current net recruiting rate, which is we have a net positive over the last 3 months of a whole 3 employees a month. it would take us 75 months to get fully staffed if this rate doesn't change. Obviously, that's unacceptable. The most difficult positions for us to recruit and keep filled, number one, of course, direct support professionals, but also our residential program managers, nurses, especially RNs, and the sort of middle management of our day programs, case managers and assistant program directors are brutal for us to to fill and keep filled, in part because those jobs have become really difficult and not very fun for people. And what we've seen over the last year and a half is a pulling out of a lot of our most experienced people and having them replaced by green employees who are generally new to the field. For the first time, I've been in this position for 13 and a half years now. For the first time in that period, we have waiting lists. Our day programs are only open approximately to 55% of pre-COVID capacity. That translates into 56 existing members in our community-based day support services are still awaiting coming back. Whereas in our Dayhab program, we have 64 existing members who are still waiting to come back in, and 13 new referrals that we can't act on and probably won't be able to take in anytime in the next year, quite frankly. In Massachusetts, the Dayhab service is an entitlement program through the state plan. That's why we're even still taking referrals. We're not accepting new referrals to our community-based day support services. And in our residential system, we have 5 vacancies that are getting filled really slowly, not because we don't have referrals, but because it's really difficult to get staff freed up enough to go through the referral process for folks. We've taken a lot of steps to address the issues, and thankfully, these things have seemed to be making some impact towards stabilization. We've increased the entry-level rate, pay rate for our DSP workforce twice in the past 8 months. And in doing that, we've also given very modest pay increases to all existing staff to try to at least minimally address compression issues. And we're doing this with one-time funds. And so it's a little nervous making. I'm hoping if there are legislators from Massachusetts on this call, you're hearing that because we're eating into our reserves. We started recruitment bonuses in August, where we are giving people $2,500 signing bonuses paid out over the first year of employment. And we also gave out retention bonuses of $2,500 made in 2 payments, one in August and the next one coming up next week. And for the 12th consecutive year, we are not passing along any increases in our health insurance costs to our employees. But that's we're being hit with a 17.2% increase in our health insurance rates. And so that's quite a bit of money that we're also eating. So in the last 3 months, when we've taken most of these actions, our turnover rate seems to have gone back down to about that 19% level, which, you know, is promising, but again, with a net 3 a month, it doesn't leave much. In terms of recruiting strategies and advertising, we're hitting every button you can possibly hit. We're on all the major job boards all the time. We're doing spot advertising directly to people's phones and targeted area codes. We have ads running on the radio and in print media, and we participate in every job fair imaginable. What's needed is higher pay and for something to be done to provide compression relief. Again, it's the middle of our system, the core of our workforce is getting removed. And we need rational immigration reform. You know, I've been in this field for 41 years, and we've always had workforce problems, nothing like this. But one of the big band-aids for us has historically been immigration. Here at RTR, we employ people from 35 different countries because we've had a vibrant H-1B program for at least the last 25 years. Right now, that once vibrant program is basically a shell of itself because of neglect by the Biden administration after the Trump administration effectively stopped it. And so, hoping that some of the bills that the Provider Council is sponsoring get enacted to help on the pay issues and student loan repayment. All right, those are my comments. Diane?
Thank you, Chris. My name is Diane Gould. I'm the president and CEO at Advocates. We are a nonprofit human service agency based in Metro West with services throughout central and eastern Massachusetts. We serve children, adults, and families with a broad range of needs. Our mission is to help people have a good life in the community with decent and affordable housing, meaningful day activities, including employment, satisfying relationships, and good health. We also partner with communities to promote inclusion, equity, and justice. Our current vacancy rate across the organization is upwards of 26%. However, there are particular positions and programs that are more significantly impacted. In our residential programs serving people with behavioral health conditions at the director level, 5 of 8 directors have left in the last 6 months, and our clinician vacancy rate is more than 50%. What that means is there are not supervisors to oversee the work that's being done by the direct service workers. Those we do have are doing shifts, and our direct care workers are routinely working 18 hours a day. They are serving people with complex medical needs, serious mental illnesses, and co-occurring disorders. We have 4 outpatient counseling clinics, and since the pandemic, we've lost 32 clinicians. 21 of them are master's licensed level clinicians. Medical team lost 2 nurse practitioners recently because of burnout. The clinicians and medical staff are leaving for private and group practice, hospitals and healthcare systems where they can earn $20,000 and $30,000 a year more with jobs that are less stressful. In our day supports, we lost 6 staff in the last 3 months alone, and we currently have 18 positions open. All of this, of course, is impacting access to care. I want to say a brief word about the need that we're seeing. The people supported by agencies like RTR that Chris spoke about and Advocates have always had complex needs, and those needs have only increased, only become more acute since the pandemic. The number of children with suicide attempts has increased significantly through the summer. And in August, we saw 4 children between the ages of 11 and 17 who had tried to take their own lives. As many as 50% of the kids we're seeing are struggling with aggression, suicidal thoughts, and anxiety. And our information and referral line has seen a 46% increase in calls for help between 2020 and 2021. So I think there's this terrible convergence of inadequate staffing with a dramatic increase in need. We have wait lists in our clinics. There are 245 people who are waiting for services, including 200 children. 54 of them need language capacity. In our region, that means clinicians who speak Spanish and Portuguese. In our day supports, there are 32 people we had been serving who are currently at home because we don't have enough staff to serve them at our day center. And we have more than 50 referrals of people who will need day supports beginning in January. In terms of strategies, we are really grateful for the rate enhancements, relief funds, and aspects of the American Rescue Plan Act spending plan that target our workforce. Like Chris, we've used these funds to increase salaries and offer bonuses for recruitment and retention. And the strategies that are in the ARPA spending plan now on the governor's desk, such as loan repayment and bonuses for essential workers, will be helpful. And I want to thank Senate President Spilka, House Speaker Mariano, and the members of the conference committee, Chairs Mikowitz and Rodrick, Vice Chairs Friedman and Ferranti, Representative Smola, and Senator O'Connor. Higher pay does help. And it seems to be stemming the tide. We're beginning to see this, too early to say for sure, but beginning to see the possibility of higher pay stemming the tide of people leaving, and the possibility of an uptick in applicants for vacant positions. However, as Chris said, the funds that are supporting these increases are temporary, and they don't address the structural problem of rates that don't support a competitive wage. The Providers Council legislation on fair pay for comparable work would help us match salaries of state agency staff, especially nurses and clinicians. But we also need rate methodology that supports a living wage for our workers. Student loan repayment and other council bill would also be helpful in attracting and retaining employees. However, there are simply not enough workers. And Chris's comments, I echo Chris's comments about rational immigration reform, because we need to expand the pool of candidates. The loan repayment bill would help the many staff burdened by student debt. And lastly, we also need models that are less dependent on staff. And that will require flexibility on the part of funders and changes in regulations. Thank you.
I think that our next speaker is Senator Friedman from Massachusetts. She is from the 4th Senate District, Chair of the Joint Committee on Healthcare Financing, and the Senate Vice Chair of the Joint Committee on Ways and Means. Senator, thank you for being here today.
Thank you so much, and thank you to Michael for extending the invitation. As you just heard, I am Cindy Friedman, and I am the Senate Chair on Healthcare Financing and the Senate Vice Chair of Ways and Means. And I was going to start by talking a little bit about some of the statistics that we found and that came through when we were doing our ARPA hearings, but I think you've heard much more compelling testimony from Michael, Chris, and Diane, so I don't think I need to go through that. I think that, and I certainly don't need to convince any of you how critical the human service sector is to our economy and our communities. This was we were totally blown away by the statistics the council cited in their testimony to us when we were doing the American Rescue Plan Act hearings in supporting the human service workers. But it's not surprising, right? This is something this is a storm that's been brewing for a very long time, and it took a pandemic to get all of us to see what the ramifications of not paying attention to the needs of our human service workforce. So while it's devastating, it's not surprising, and that makes it even more unacceptable. Historically low rates of pay and the difficulty in finding jobs that serve complex populations has resulted in these high vacancies, frequent turnovers, long wait lists, and the permanent closure of certain programs. So, while it absolutely was exacerbated by the pandemic, this was a history long in making, and none of us in our legislators' respective legislatures should be surprised at what we're facing now. So without this solution to the workforce crisis, an increasing number of jobs will go unfilled, and the deterioration in the quality of service to our most vulnerable residents is going to be the effect of it. So the Massachusetts legislature recognizes the crisis at hand, and just last week, as you've heard, responded by allocating $30 million in ARPA funds to human service workers. Of the $30 million, $16.5 million is for a loan repayment program for human service and home health workers, and $13.5 million is for a grant program for human service organizations and home-based health service agencies to support the retention and recruitment of workers. While this is welcome and it's significant, I recognize that it's only temporary funding, and I appreciate the need to do more. There's two things I will point out. First of all, I'm hopeful that the Massachusetts legislature can also pass a bill that I filed and that you heard about. It's one I worked on in collaboration with the Providers Council that will require the state over the course of 5 years to increase its rate of reimbursement for human services providers in order to reduce and ultimately eliminate the pay disparity. You heard it. It's $500 and some dollars for community-based workers and over $1,000 for state workers. Passing this bill would be a fair and effective step to recruit and retain our valuable human service workers. So while we've made significant strides, our work to address the human services workforce crisis is far from over. I think the other piece that we need to be reminded of is that in Massachusetts, we believe we're going to have another bite at the ARPA money, because I think prudently we didn't spend it all in one fell swoop. And so I know that we can, and I'm looking forward to, and I'm committed to going back to the pot to get more services, to get more money for services to at least help us through the next 4 to 5 years. I appreciate all the work you do. I can't think of better advocates or people with more compelling reasons to support an increase in funding for this area. I wish I could do something about immigration. It's a little bit beyond my pay grade, but I know that working together, we all can at least make a difference and continue to support our most vulnerable citizens. So thank you so much for letting me be here.
Thank you. Thank you all. Next, we're going to talk a bit about the situation in Connecticut. I touched on it earlier. I think I can sum it up in one sentence. We are at a crisis point. And here to talk about the crisis first is Heather Gates, who is President and CEO of Community Health Resources.
Good morning, everyone, and thanks, John Carl. I'm Heather Gates, and I'm the President and CEO of Community Health Resources. We're one of Connecticut's largest behavioral health, housing, foster care, and residential providers. We are serving over 27,000 children, families, and adults every year. We have over 900 employees. We have outpatient clinics, many evidence-based in-home teams and services out in the community. We have methadone clinics in 6 prisons in the state. We have foster care. We have 110 residential beds for kids and adults, both mental health and substance use treatment. We have extensive supportive housing, and we have mobile crisis teams working with both kids and adults. So we're a very comprehensive provider, and I think it's safe to say that staff in every single one of those programs, staffing is a challenge, and folks are really worn out and tired and really, I think, kind of perplexed, in all honesty, at what has been a lack of help and support coming to them, except what we've been able to do as an individual agency. And then most recently, because of some great leadership in our state legislature, have been able to finally receive a cost of living increase on our grant money and distribute raises to our staff. We are experiencing workforce challenges really from throughout our organization. We employ peers, and we have folks with bachelor's degrees, with master's degrees, APRNs, psychiatrists, physicians, lots of RNs in our methadone clinics. And there's not a single discipline that is easy to recruit for right now. We recently had to give 15% salary increases just to our master's level clinical workforce in order to stem the tide of departures into private practice, and in some cases to the state of Connecticut, as well as federally qualified health centers, which are reimbursed in a different way than behavioral health clinics, as many of you are aware. From our perspective, we're seeing the collision of decades of underfunding, ignoring the services we deliver, ignoring in many ways the people we serve and are devoted to, and that collision with the pandemic and the demands not only on our workforce, but significant increases in the demand for services at our front door. In Connecticut, as an outpatient provider, we have something called an enhanced care clinic rate, which requires us to see people in certain periods of time. It's virtually impossible right now to meet some of those standards because of the lack of staff, despite the demand at the front door. So we are doing the best we can to triage and work with individuals who have some of the highest needs, and figuring out where do we refer people otherwise who cannot come to us because we don't have adequate staffing to meet that need. We are also providing services in many schools throughout the state of Connecticut, and we're just seeing the impact of the last year and a half, almost 2 years now, on children and how much help they need at this point in time. And again, that requires staffing, and that requires money to pay those staff. Our Medicaid rates have not increased in almost 20 years until very recently. And then quite frankly, the increase, however appreciated it is a drop in the bucket compared to what we need to do to recruit and retain qualified professional staff in all of our clinics. We've of course had to do hazard pay. We've had to do one-time pay, like others have talked. You know, we're doing hiring incentives. We're handing out money sort of left and right without regard to are we getting any money in, and that is panicking me, just like Chris described, as we project forward to next year, where we're looking at big gaps between the funding we're receiving and the amount of money we are paying to just fill vacancies. I'll leave you with just a couple of facts about what this all means on a sort of level, real level. We have about 170 vacant positions right now out of over 900. That's about an 18% vacancy rate. 38 of those are clinical staff. And if you figure each of those individuals is serving about 80 children, families, or adults at a point in time, that's about 3,000 people every week, every month, every quarter, every year that are not getting service. And you add that up when you think about the folks coming in and out of treatment. That's a significant number of individuals with very substantial behavioral health conditions who are not getting access to services that they need. We are looking at, we've had to close residential programs at different points in time because of lack of staffing. We're going into an uptick of cases. We expect we'll have to do the same thing again this winter. About 30 to 35% of our workforce leaves to go to higher paying jobs. And we're also seeing a dramatic increase in position abandonment. This is people who just don't show up for work one day, and then we're scrambling to cover shifts or cover services. So I'm sure as you'll hear from others, you'll hear similar kinds of experiences. But I think it's safe to say in Connecticut, We have a significant crisis in the human service sector, and it will take a major investment of funding to try and stabilize things. The funding we did receive recently is a help. There's no question about it, but it really needs to be sustained, more significant, and a plan needs to be developed to address this over the next 5 years, because a 1-year influx of funding isn't going to stem the crisis, and it's really not going to get the job done. So I appreciate your time today, and I think turn it back to John Carl.
Thanks, Heather. And I will turn it over to Barry Simon, who is the CEO of Oak Hill.
All right. Well, good morning, everyone, and thank you. So I am Barry Simon. I'm the president of Oak Hill. We are a leader in providing the high quality community-based specialty healthcare and special education throughout Connecticut. We have 20 different kinds of programs that we run. We have 152 program sites, classrooms, and group homes that are located in 77 towns around Connecticut. We employ over 1,700 professionals who help meet the changing needs of approximately 30 to 40,000 people every year, depending on how many come through our doors. We're also among, the 300 other nonprofits throughout Connecticut that are providing these kinds of services. But I will tell you, as the largest purchase of service provider for services with people with disabilities in Connecticut, it is really difficult to do business in Connecticut. We're now facing a budget which is going to put us on 17 years and counting of no net increases or actually decreases in our rates. As you know, and as has been told, we too have been ravaged by COVID-19 with employees that have gone, above and beyond, but frankly, are feeling demoralized after years of neglect in the state budgeting process. It's hard work and they're burnt out. It's certainly over this past legislative session, it's been refreshing to hear a lot of words of support from our legislators, and they did give us some wage pass-through dollars, which have, are sorely needed, but they have not kept up with our need. And so for our legislature and our governor who have choices, we are hoping that, we end up being a priority in the budget process as it continues to go forward. Specifically for us, programs have closed in the last few years, and we're continuing to do so. We've made reductions in some programs. We've reduced staff. Developing business strategies, it's next to impossible. Specifically, we have closed recently 3 residential programs through consolidation, and we're not taking any referrals, although we are called constantly to admit people from hospitals and transitional programs. We currently have 200 staff vacancies. We have been the recipient of strike notices. We have, this time that we're in, it's really impacted our services. We too have needed to raise our hiring rates for our RNs or OTs, PTs, LPNs, LCSWs, master's level clinicians by 10 to 15%. Which is far above the 3% increase that we received this year on top of years and years of neglect. We deliver the state's core services, and yet we're forced to operate on these repeated underfunded budgets. We have had to do many of the same things, hazard pay for essential workers and frontline workers. We have to provide PPE equipment and cleaning supplies. we've had to prop up telehealth services. We purchase the necessary computers and cybersecurity and online meeting platforms in order to provide these services. But we have no avenue other than to turn to the state, for our rate increases, which, they don't seem to want to do. And again, it just makes it incredibly challenging for us to keep providing these services. We have certainly a long history of being ignored. We've been forced to operate under, separate and unequal payment systems. The stagnant rates have cemented, a poverty wage for much of our workforce and challenged our ability to fortify the infrastructure that's needed to run any successful business. Call it a civil rights issue, call it just a state that might be willing to support businesses that they, deem as their partners. But I will tell you that dealing with, in my 30-year career as a CEO, unfortunately, this has created an untenable situation. The ability for us to avoid strikes, the ability for us to eliminate poverty wages, and the reality of equality and, being able to run a successful business is really in the hands of our politicians. So we hope that they, see and are willing to treat us and appreciate us as a business that's a vital partner with state government going forward. But man, it is hard. And I know that many of the people on here are saying the same thing. So thank you.
Thanks, Barry. I'm going to take MC prerogative because one of the speakers on our panel today has to leave shortly. So I'm going to throw it over to Tina Spears from Rhode Island.
Hi, my name is Tina Spears. I'm the Executive Director for Community Provider Network of Rhode Island. I'm gonna hand my speaking time at this moment. I'll come back after Senator Palma speaks. I wanted to give him the opportunity to speak before he has to attend a press conference today related to this very issue. So I thought I'd turn it over to him, Senator Palma, who's been a champion and advocate for the last decade of his tenure in the Senate for these issues. Senator Palma.
Tina, thank you very much. Am I good?
You are good.
Tina, thank you very much. It is a honor to participate in this with this very august group, and thank you for your leadership with the Community Provider Network of Rhode Island, which they have led in a exemplary fashion since getting there. What we've heard, and I want to thank and being a part of the effort with our neighboring states of Connecticut and Massachusetts. While I don't have a lot of affinity for Mass, nothing against Mass. I'm originally from Bridgeport, Connecticut. I have family in Bridgeport, Connecticut, Norwalk, East Lyme, other places. So I do have an affinity for the state of Connecticut. Just about everything that's been said, with the exception of the student loan repayment. So we have a slightly different program called Rhode Island Promise. Won't get into that now. Every place everybody said, we or us in Massachusetts or Connecticut, you could have said Rhode Island. And there's one caveat to that in a minute. We certainly are all in this together. I'm going to make a statement now. I'll make a statement in the end, and I have a little timer here to make sure I don't go over my time. The time to act is yesterday. It's not even now, it's yesterday. We can't take no for an answer as a community, and I consider myself part of the team, even though I am in the legislature. I've been here for 13 years. I am the first vice chair of the Senate Finance Committee, head of the Health and Human Services Subcommittee on Finance, chair of Oversight and on Education. So like many of you and many of my colleagues who will speak after and have spoken, this issue is critical and it's important to myself, many of my colleagues, and many thousands of folks in the state of Rhode Island. It is categorically in the hands of the legislature and the legislators. I ask all the folks here who are not legislators, my colleagues may not like this, but hold us accountable. Don't take no for an answer. Every day you should be asking, what are you doing for me today? Because I say that to myself, what am I doing for you, this collective group, every day? A couple pieces I do want to talk about, like as I indicated, everywhere it said we or us, Connecticut or Mass, you could have substituted in Rhode Island, and we're all in a similar situation. A system in crisis. We've had some situations where they've run critical. I'll end up on the conversation at the end about a press conference I'm going to go to on the governor. I'm here representing the chairman of the Senate Finance Committee. He couldn't be here today on our expected announcement on allocating ARPA funds, some CARES Act money, et cetera. We're only going to address this issue appropriately and in the right way when we value the profession. When we, the legislature, value the profession of the frontline workers, we will address the issue and fix it once and for all. Until we do that, anything we do will be a Band-Aid, and it will not be long lasting. A vector to how I think we address that, and several of my colleagues already mentioned it. Clearly, we need a starting wage. We're looking at having a starting wage campaign. We've had legislation in over the years to address that. We're really looking at a starting wage campaign as well as a campaign for existing workers. So we're not concerning ourselves with existing workers. We need existing workers and new workers. The other piece that we need to be looking at, as several folks have indicated already, is the rates, the reimbursement rates we pay to the various private providers. And the vast majority of our services in the state of Rhode Island are performed exemplary fashion by private providers, all done by Medicaid rates or other rates that are not Medicaid. Some of those rates have not changed in 2 decades. As you've heard, like I said, so sounds like you're beating the same drum we're all beating, yes. So we're looking at legislation that has been introduced, is being modified, that will allow us to be and do a rate reform on a very regular basis across all rates, Medicaid, Chafee funds, Title 4E, and I'm missing probably 6 or 7 or 10 others. It's critical we do something right away. I talk about dying by a death of 1,000 cuts. That's what some of our organizations have experienced. So we need an infusion of cash to keep those folks there today. That's the short term. The long term is to put in place a rate review and a rate reform that will ensure the situation we're in now. And there's been a dim light, I'll say, in my 13 years in the Senate, and I'm accountable for not getting this done. I take full responsibility for it. We've had a dim light focus on the situation for the last, I'll say, my 13 years here and longer than that. What the pandemic has brought forward, it has shown a laser spotlight on this and shown how fragile the system was and has become. So we have, in the case of early intervention services, all of our agencies that provide early interventions, all of them are all waiting list. We have everybody's being deferred. That's unconscionable. I think we're going to hear in about 5 minutes or so a press conference the governor, the Senate president, and the speaker will be at. I'll be at as well. We're going to seek to address that. One of the other challenges, and I'll finish on 2 other items, we have in Rhode Island, which Mr. Weeks, when he spoke earlier, I was going to say, we're glad you are where you are, and Connecticut is where it is. If you looked at the rates in Connecticut and the rates in Massachusetts for a whole range of health and human services, we are below that. And the vast majority of Rhode Islanders live within minutes of the Massachusetts border. People can not walk there, but they can drive to a place of employment, get there in minutes, and be paid 10, 15, potentially 20% more than we're paying in Rhode Island. So we are even more at a crisis than our neighboring states of Connecticut and Massachusetts. One area that has been addressed, and it's unfortunate that it got to this, there may be others that may come down the line, was a contempt order by the Department of Justice, which are DD services, has put in place some requirements for the state to do something. We'll see whether the state does that or not. There's been a commitment for the state to do that. We're going to see where we go. Let me end by finishing where I started. Tina, thanks again for all the work that you do and CPNRI, what it does, all the other leaders here and all the other folks on the phone, and my all other colleagues from the state of Rhode Island that are on here as well. The time to act is yesterday. We cannot take no for an answer. And I consider myself a member of this extensive team. No cannot be an answer is acceptable. It is in the legislature's hands, categorically in our hands. And people, when someone says there's no money, you need to say to them, when you make it a priority, money will be there. It's my job and others to make certain it's a priority. When it's a priority, the funding will go. The last piece about the investment, we invest in the folks, the frontline workers. It's critical that we do that. Yes, it is a cost. It will be a long-term investment that we need. We also need to look at the other side of the equation with regards to the investment and what that does to the economy. It's a positive investment in the economy. We all know those at the lower end of the pay scale, when they receive a pay increase, typically plow that money back into the economy. We can't just look at this as a one-side money sink perspective, money drain. We've got to look at it as a money source perspective. So while money is going out, quality of life is better, lower cost long-term in some areas, but also an impact on the economy. So Tina, thank you very much. I will be stepping off in a few minutes, but I plan to be back after. Thank you.
Thank you, Senator. Would you like me to just jump right in? Okay. Again, my name is Tina Spears, and you heard from the good senator here in Rhode Island, and we have other great champions in our General Assembly, and you'll hear from Rep. Kassar later today. But I just want to tell you a little bit about our work here in Rhode Island. I am a trade association that represents 31 organizations providing services for children with disabilities and adults with disabilities. So we have a good segment of the health and human service sector. While we don't represent it all, we are working very closely with our sister agencies, with the Rhode Island Coalition for Children and the Substance Abuse and Mental Health Network. So we are entrenched across the system, and we know what. Senator, you're not on mute. What impacts our industry impacts across the system. I will not repeat what my colleagues from Connecticut and Massachusetts spoke about. We are indeed in the same circumstance. We find the same challenges that we are seeing in Connecticut and Massachusetts. And to the senator's point, we are in a more dire circumstance because we just are sandwiched between Connecticut and Massachusetts, and we've had less progress, if you will, on rates and investment in these categories of service. I just want to pivot a little bit about what some of the other speakers spoke about today and really talk about the equity piece, the gender piece, and what this means to our communities. I think we've gone down this road of devaluing a particular population of workers, and we just need to say that. I'm just going to say it. There's a lot of investment that goes into our public, our fire, teachers, other state agencies, and they provide essential services for our communities. These services are just as essential. They're essential for not only their well-being and their quality of life, but really for, someone spoke to the civil rights element of this. This is about people's ability to live and remain a quality life, a meaningful life in our communities. We know what the injustices of our history are. We are treading on water right now, and we are taking on water, and we're sinking. And we need to take serious action, not only for our workforce, but for the workforce that is empowering the ability for people to live in our community. This goes beyond just a workforce issue. And we all know that not only does this workforce issue impact our marginalized minority communities, it is predominantly women. Women are impacted by this decompression of their wages over time. And I think it's our opportunity here. We know what the problem is, and we also know what the solution is. So this is my call to action for my community and for my partners, is to say, just as the senator said, we will not take no for an answer. And we need to work on the policies that are not only going to improve the number of workers that come to this industry, but really, really take a hard look at how we value and compensate and prepare this workforce. So that's what I will say from here in Rhode Island. We have the same statistics. Everyone's heard it. We know that the issue. And our senators and our representatives here today, I know, support progress in this area, and we do have many initiatives that we'll be presenting to our General Assembly as when they reconvene in January. And I want to turn it over to the others that are going to speak today. I don't know if I'm introducing or if you are, Carl.
Go ahead, Tina.
I'm going to ask Liz Weinhofer from Life to speak, and she will talk to you about what she's experiencing in her organization today.
Sure. Thank you, Tina. Thank you for the time today. And I agree and have been experiencing many of the same issues that my colleagues have talked about here. I'm going to try not to duplicate everything that has been said, but again, we've been experiencing many of the same things. So my name is Liz Wiedenhofer. I'm the Executive Administrator for Life Incorporated. We're a private nonprofit agency that's celebrating our 35th year of service. We support about 110 adults with intellectual and developmental disabilities statewide, but we have a high concentration in the East Bay and Bristol County areas. And our services include a variety of residential options, employment services, and community-based person-centered services. So when I think of what our ultimate intention is, it's to serve and support those with IDD to take their rightful seat at the table in our society and to support and facilitate the opportunity for meaningful membership through the person-centered services that I spoke of. This is the ideal, this is the goal, but it certainly is not a daily reality to scale, much due to the exacerbated workforce crisis that we've been talking about, a crisis that definitely was with us before COVID, but has grown exponentially since COVID. So to speak a little bit about the staff that we do have during this shortage, I mean, we quite simply cannot ask more of them. At Life, and certainly within my sister agencies, we have a core of dedicated, experienced staff that are being stretched thin more than ever before, more than I've ever seen in my 25 years doing this work. And the ways that they're stretched, they're picking up countless hours in overtime to fill gaps because they don't want to let their coworkers down and the people that they're supporting down. Many are playing double duty between having regular and regularly scheduled direct care hours and also performing their support coordination jobs or admin jobs or nursing jobs. It's certainly an all hands on deck situation that we're experiencing. Those staff are constantly training new staff because of the turnover, and they're also holding their breath that new candidates will come in the door and stay. And as you can imagine, the combination of all of this is detrimental, has detrimental effects on morale. So this type of layering of work roles, this type of picking up the slack for the shortage brings the larger infrastructure of our agency to an absolute slow crawl, which has made us put a lot of our well thought plans on hold, plans that include expansion to meet service demands. Like it's been said today, we know the need is out there and we want to meet that need, particularly in residential services and employment services. And also, it's been alluded to the consent decree that we have in Rhode Island. We have plans for transformation to provide more individualized person-centered services instead of the antiquated segregated group model that is not in line with the consent decree. To do these more person-centered services, we know we need to build out a strong training curriculum that is designed through a civil rights allyship lens and have a strong career ladder system. We know how to do this. We want to do this, but we just simply can't move forward with it because of the work crisis. It's like having the emergency brake on, but we're trying to get to the highway. We just really can't do it. So the staffing shortage also, as I alluded to, has us on hold for meeting the service needs of many that we had a plan with before COVID or had a relationship with before COVID, as well as making it incredibly difficult, if not impossible at times, to transition new referrals into our services. When I was thinking about for this session, as service providers, I feel we hold the values of inclusion, of building independence, of community contribution and membership. We also serve people and families who present with a spectrum of needs, of complexities and wants. So to best serve this community, we need a provider service system that can match the complexity of that spectrum. We need service providers that can be nimble, can be flexible, and can meet people where they are at. This takes a purpose-driven, fairly compensated, trained staff with distinct skill sets and lenses. And we just simply, like I said, we don't have enough of them. All of this is just so interrelated. And, you know, we look forward to moving the needle forward in this inclusion movement. And but thank you for listening to these concerns and barriers to be able to get there.
Carrie Miranda, I think you'll be up next.
Hi, my name is Carrie Miranda. I'm the Executive Director of Looking Upwards. We are a Newport County-based organization, nonprofit, but we provide services throughout the state of Rhode Island. We are one of the larger organizations in the state providing this service. We serve about 1,300 adults and children and their families annually, and we should have about 1,000 employees. Currently, we have about 680 employees. So we consider ourselves to be in an employment crisis like everybody else here providing services. Grateful to be at the table today, to be part of this conversation. Also grateful for our organization to be in Senator DePalma's district. He's an incredible champion for us, and we are always in conversation with him about our ongoing issues. A couple things I want to mention that I've mentioned at other conversations. I was at an anchor conference in DC, probably close to 20 years ago, when there was a session that discussed the looming workforce crisis that was going to be, it was projected out quite a distance. And I thought to myself at the time, I'll be really old when that happens. So there's two things that run through my head right now. Either I am really old now, which I'll have to think about, or that crisis came quicker. And so I think both of those are true, actually, which is a reckoning I'll have to deal with. But I do believe that we had some more time had it not been for COVID and for it to be this height of a crisis. I think that COVID accelerated that crisis for us and really blew the lid off of this. I think it's an opportunity. So I think we have to look at this as a collective, as an opportunity for us to really, really think about the work that we need to do as a collective. It excites me to think that that all weekend long, I heard at least 2 to 3 news conversations happening around the childcare workforce crisis, and that they're bringing it back to workforce. That's really important to us as well, because that's part of our workforce demographic, if you will. So I don't think that these are competing agendas. These are complementary agendas, and that is an important point for us. So I wanted to comment on that. What does this crisis mean to us at Looking Upwards? It means that we serve less people, because we have to put our workforce into that 24/7 support model, because you can't close at 3 o'clock like my Starbucks down the street, which really ticks me off because I need my coffee to do my job. But I do understand why they close at 3 o'clock. We don't say see you later at 3 to anybody we support currently. However, what we do say is we can't support you at all. And that's a real crisis for families and individuals, way more than my Starbucks crisis, by the way. The other thing that I want to say for the first time is we've had to close for new referrals for early intervention, which if any of you have had an early intervention baby, I have as a parent, that's a crisis. That's a significant crisis. There's no way baby coming out of the hospital that needs those early intervention services. The entire state of Rhode Island of early intervention providers have said, no, I'm sorry, we cannot open our doors for a new referral. That is probably one of the craziest crises. And that's happening as we speak at this moment. That's part of that press conference that's going on. Interestingly to me, I believe that there is an idea that there's a Band-Aid fix. I'm not sure that it's the long-term fix that the service providers need to keep our clinicians on board, and I am concerned. One of the things that we're doing as an organization is I'm choosing to leave vacancies in our residential programs, dragging my feet a little bit on closing and consolidating because I know that the need is so great out there. I like other models, but I do believe that there are people with significant needs for a 24-hour model, and I'm not ready to throw that back together and consolidate it quite yet, but I think it's going to happen soon, and I'm going to have to make that decision. I'm holding on a little bit longer on but I'm concerned. And I do want to just also mention from a COVID perspective, we're not out of the woods on this one yet. We are still deep in it. I had 3 staff test positive for COVID over the weekend. Tremendous workforce crisis. We're just compounds in a massive way. I have a director sends out an email that says, I will be working the next 10 days in absence of that overnight staff person that is now out. And I don't know how much contact that person's had with other people in that team and what that means. So it's still happening regardless of vaccines and boosters. We are definitely still in the soup here. So, and I know everybody else is as well. So I would like to keep my comments short and sweet. Thank you so much. Appreciate it.
Thank you, Carrie. I'm going to ask Representative Kathy Abercrombie from Connecticut to jump in. She's pitching in today. We really appreciate it. She has been a great supporter of our sector through the years as chairman of the Human Services Committee and as chair of the subcommittee on Human Services for Appropriations. Kathy, thank you.
Thank you, John Carl, and good morning to everyone. Let me first thank John Carl and his team, Ben and Jeff, for putting this together. I think it's great that we have other states on here where we can share thoughts and ideas. So to Massachusetts and Rhode Island, thank you guys for being here. To my providers that are here, I just want to say thank you, thank you, thank you, because we all know it has never been more difficult than it's been through this pandemic. And I just want you to know that we as legislators do value you, and we do appreciate everything that you have done. And I know what you're going to say, put your money where your mouth is, and you're absolutely right. But here in Connecticut, we were in an unusual situation because through the budget process, which the governor signed and went into effect July 1st, we had put millions of dollars in for providers. But at the same time, the governor was negotiating to avoid 2 strikes, one with the nursing homes and one with providers for the DDS population for group homes. So here, all this money that we were trying to spread equally amongst our providers, which everyone knows is not an easy job, millions of those dollars were swept because of that. So I just, for my providers that are here, know that we really did try in this budget to do the best we can. And we do value everything that you do for us. In Connecticut, we're unique in the DDS population because 90% of our providers are private providers. So I saw in the chat that people were asking about state services versus private services. We value the private sector. And for that reason, our group homes, 90% of them are private. So we do appreciate everything that they do. I will say that I have been up here 16 years now. I've been on human services my whole career. I don't think we've ever been at a tipping point that we are right now when it comes to the workforce. And I can tell you that for those of you that don't know me, we've been meeting, a bunch of us, on appropriations for months now, trying to figure out what does the next legislative session start. Ours starts in February. It's a short session. You blink and it's done. We're February to May. But we know that we have millions, almost $300 million left of ARPA dollars, which I'm glad that we did hold on to those dollars because we wanted to make sure going into the next session where there's gaps, right? Where do we need to reinvest those dollars? So financially, Connecticut's in a really good place. Even with our budget, we are in a good place. We're already showing surpluses, which is going to be great for our providers. I'm really looking forward to listening to all of you to try and share ideas and thoughts. I like some of the thoughts that were already presented from Massachusetts. I've been taking notes here about fair pay and things like that. But I think, you know, for my colleagues that are on this call, because of my colleagues, legislators that are here, we really want to hear from you. We really want to hear what the other two states are doing, because, you know, why reinvent the wheel, right? This is great that we're able to all be here together and to share ideas and thoughts. But for my providers that are here, you know, I can't say thank you enough. I can tell you that we're very, very concerned about the mental health portion of this. I remember back in 2020, we were meeting monthly with our human services agencies, public health, human services, DSS, DEMIS, all of them. And I remember hearing somebody say back in May, you know, the mental health piece is going to be around for a long time. And I'm thinking, well, COVID should be done in a couple of years. What are they talking about? And here we are, fast forward, in a crisis. Our kids are being left in the ER longer. We have a lack of beds. So we have two groups that are working on that right now. There's actually here in Connecticut, through appropriations, our forum is going to be on December 13th, which all the agencies, human services, are coming before appropriations to talk about financially where they are with the dollars we've given them and where they think we need to go. So the mental health piece, we as a state are really taking seriously. And I hear from the other states too. This is really at a crisis issue, whether it's our kids in school. We have a high school here in Connecticut that has been closed on its second day now because the amount of violence that's going on there. And we're hearing it's because of the mental health. There's not enough social workers. There's not enough, you know, of that expertise there. So I look forward to hearing about that and some of the solutions that some of you are doing. But I really just want to take this opportunity to say thank you to all of you, especially my providers in Connecticut. And I look forward to hearing how we can really try and face this challenge and what solutions there are out there. So thank you, John Carl, and thank everyone for being here.
Thank you, Representative Abercrombie. Thanks for pitching in today. I think we will go back to Rhode Island for one more panelist before we turn to the questions.
Yes, and that will be Representative Kassar. Representative.
Great. Can you hear me?
You can.
All right. Thank you so much. I'm Liana Kassar, and I'm in my second term in the House of Representatives, and I serve on the Health and Human Services Committee as well as the Small Business Committee. And Rep. Abercrombie, I wish I could say that we had some best practices in Rhode Island that I would love you to take a look at, but the reality is that we're struggling as much as every other state, and as a representative, I'm deeply disappointed in my legislature, though hopeful that we are going to be making some changes. I know the announcement today from the governor and the speaker and Senate president are a step in the right direction, or at least I hope so. I have not heard all the details of that yet. We have such structural challenges that maybe in a year or two, I can tell you what a best practice is, but I don't think we can make that recommendation right now. But thank you to everyone who put on this conversation, as opposed to being in isolation with the frustration and the challenges of this work, coming together to look at how the care economy is working for us is critical, because we are a small area and it crosses state lines and our economies impact each other. And I want to thank Tina Spears for all of the advocacy and the work that has gone into cheerleading, not just cheerleading, but lobbying and educating our legislators about what has been happening for her members, as well as the members of the other consortiums around the state. So one of the things that pains me about this conversation is that when I was canvassing for the first time in 2018, there was a workforce crisis. It was clear when I knocked on doors. I could tell from families I spoke to who were in need of services, or a family member had fallen through the cracks of the system, or there were constituents and leaders who worked in this sector. Everyone in human services in mid-2018 was already working at their limits, and all of our agencies were working on the thinnest of margins. There was no margin for error. As a legislator, I can tell you that the proportional impact of the hundreds of voices of this sector within the legislature is not equivalent to the voices that have impact on leadership within our chambers. That is something that is very concerning and an opportunity for us here. Prior to the pandemic, I would see Liz and Tina and dozens of other individuals representing our human service sector and care sector in the halls of the State House. Childcare, behavioral health, service providers for individuals with intellectual and developmental disabilities, substance use treatment and prevention folks, hundreds of people. If they had the proportional impact on my colleagues and our leadership, we would be talking about a very different funding stream. But in fact, as we know, in every state house, some voices are heard louder than others. Some voices have access to the offices they need, and others remain outside of it. The care sector is truly, in my opinion, the sector that has the biggest opportunity for stability in our economy. These jobs, this work, it's never going anywhere. The Rhode Island jobs are going to stay in Rhode Island. The Connecticut jobs are going to stay in Connecticut. While this is also the most destabilized sector of our economy, it's a sector that is plagued by the common yet unacknowledged forces in our culture of ableism, sexism, racism, and ageism. While those are the real and driving factors, they show themselves through this lack of investment in our states and in our communities. The care sector that you all work in and we all advocate for is the connective tissue for the entire rest of our economy. And as you well know, there's talk in our legislatures about job development and workforce development. This sector, until the pandemic, was never considered in that. When my colleagues say things like, we need to bring well-paying jobs to Rhode Island, I often say back to them, we have jobs in Rhode Island, we need to make them well-paying. I hear from, as a legislator, I hear from agency leaders, I hear from parents, I hear from clients, I hear from clinicians. Everyone is suffering, and everyone has been suffering for years. There was no fluff beforehand. So this sector has really been starved by our legislatures and executive branches, while tax breaks, investment, and technical assistance programs abound for what is known as small business and our innovation sectors. When our state legislatures and executive branches discussed this workforce development, only recently have we started to say workforce development. And we also do it with, what I'm hearing from colleagues is workforce development and rate increases or rate reviews. We don't even always get the commitment to rate increases. We need to make sure to drive the language that we're here. So this is such a dire situation for all of us who work in, care for, and advocate for this sector, while it's also, as I said, an opportunity. The statistics are clear. The human services sector is a driver, economic driver in all of our communities and all our states. As Senator DePalma said earlier, we in Rhode Island are at the bottom of the list. The convenience for our workers to go to Connecticut and Massachusetts adds some extra drag, some extra undertow on our economy. So as a state, we have got to figure out how to do at least as well or better than what Massachusetts and Rhode Island are doing. When Michael Weeks, I believe, was the person who said the rate $16.79 per hour average, I texted Tina with like exclamation points, like, oh my gosh, I would be so happy if we could even get to that average, which is really sad because it is not a living wage in our state. So one of the opportunities for us is to engage the chambers of commerce. And it's not only up to us. it's up to us to say to these other folks who are strong players in our legislatures and our economy, what are you going to do about this sector that supports your workers? What are you going to do about this sector that supports your businesses, your Starbucks, your pizza places, your everything, right? Because if those sectors really are serious about equity, it is time for them to see that benefiting from the publicly funded advantages that build their corporate presence and their entrepreneurial ventures, that we also need to have their advocacy. So I think we have an opportunity with the chambers of commerce, the corporate sector, our healthcare sector. These folks should and must be engaged in this fight with all of us. We need to be advocating for this statewide evidence-based strategic planning. We need to be advocating for statewide workforce development. We need to advocate for equitable workforce development. You know, I think it was Barry Simon who said the words, "This is a vital business and we should all be working in partnership." So if you've spoken to your legislators, please speak to them again. If you have a story to share it again with someone else who has leverage in our legislatures and in our executive branches. If you know anyone who has political leverage, contact them and ask them what they know about the human services sector, and rally the people who are those who are most interested and most able to tell the story well. I really have this belief that I don't want any of my colleagues to question the next time we are at the budget cycle, whether or not, you know, should we be increasing? I don't want to talk about $1 an hour. If most of us as professionals got $1 more an hour of an increase in our salary, that would not feel like enough because everyone has worked extremely hard. This sector has kept us going through the pandemic, and it deserves our thanks. It deserves our investment. It deserves our respect. So we need to be developing partnerships, and we need to use these partnerships to continue to advocate for the investment in this sector. Let's get a foothold into the leadership offices in each of our state legislatures and keep it for the long term, because we have a lot of work to do to fix the structural problems that exist. Our economy depends on it and our families depend on it. So I think we can do this. Thanks.
Thank you, Leanna. That's great.
Thank you. We are like a well-oiled machine here at 11:30. We have about a half hour left for questions. There's some that are in the box, the Q&A box. I can read. I'll read them in order that they came in.
John Carl, can I do a quick question logistics here?
Sure.
For folks if they missed the chat? So we, like John Carl said, we have about a half an hour left, and so if you have questions for the panel, please feel free to write them in the Q&A box. I then might chat you and ask if you would like to if you'd like to share them live with us. Otherwise, we'll read them. The other thing you can do is just click in the lower part of your screen, click raise hand, and I can promote you to be allowed to speak or to become a panelist and turn your video on, either one. If you do, please feel free to share stories of what's going on at your particular agency in addition to questions, and then we can try to sort of move through them as they go. So I'd also, just before we start, John Carl, if you don't mind, like to just acknowledge the legislators that we have with us today. In addition to those that you all heard from, we have about 29 legislators who are with us today. I'll start in Rhode Island. In addition to Representative Kasser and Senator Palma, we have Senator DeMario, Representative Ruggiero, Representative Tanzi, Representative Kislak, Representative Bell. From Massachusetts, also here with us today is Representative Robertson. And then in Connecticut, we have a long list: Senator Kushner, Representative Exum, Senator Austin, Representative Steinberg, Representative Phipps, Representative Farrar, Representative McCarty, Representative Smith, Brian Smith, Representative Thomas, Representative Pettit, Representative Cook, Representative Comey, Representative Gilchrist, Representative Elliott, Representative Winkler, whose question we're going to answer right now, Representative Curry, Representative Porter, Representative Michelle, and finally, Representative Candelaria, all here with us this morning. And thank you very much for listening about this crisis. And we will kick things off if John Carl, if you don't mind reading Representative Winkler's question. I think Barry was going to answer it.
I will do so. Representative Winkler asks, he says that in face-to-face meetings between legislators and the intellectually and developmentally disabled community, there appears to be widespread bipartisan support. So why does this not translate into financial support for those providing services to this committee? And Barry, I think Ben said that was teed up for you.
I guess I'm going to give it a shot. So I know that, there are differing points of views on what kinds of services should be funded. And I would say at times that often becomes, the reason why legislators will say, well, you guys need to decide what you want funded, and then we will decide, if we can fund it. Unfortunately, I feel like that puts us in a situation where at times it feels like, as the victim of being underfunded, I'm being blamed for the issue. And so, this really, as has been pointed out by a number of speakers, the reality of our rates, we are specialty healthcare providers, and being thought of and valued as healthcare providers means that our rates need to be able to sustain the infrastructure and the professionals that we need in order to provide those services. So, I don't know of any service that can exist where, just to point out, our rates have not been adjusted in, 17 to 20 years. And that's the bulk of our, A&G, as well as our labor cost is in there. So where, oil and gas and electricity and all of the technology, computers that we need to provide our services, the electronic health records, just to point out that, gas was about $1.50 a gallon the last time we saw a rate increase. The iPhone had not even been invented the last time we saw an increase. And these are just staples of our need in order to provide our services. So, hopefully legislators will see us as vital, specialty healthcare providers in the state. And, I love the quote that Representative Kassar just said, where, we already have jobs in Connecticut or whatever state. We could make them, high paying jobs. And that's not just our line, our direct care providers. We all provide, and have professional staff, nurses, OTs, PTs, docs, behaviorists, residential managers, all of which deserve reasonable wages as well. But when the legislature micromanages our rates such that we're not able to adjust where we need to, we are not able to provide or manage our businesses the way we need to in order to, pay and have the infrastructure that we need to keep the businesses viable. So I hope that answers the question, maybe as to why, but that's usually thrown at us as to the why.
Thank you, Barry. We have a question from John Craven asking if Connecticut providers can specifically talk about how serious the staffing crisis is and which areas viewers at home would notice first.
I can take that one, John Carl. It's as serious as it ever has been. And I've been in this work a very long time, longer than I will talk about here in numbers, but I have never seen it like this. We have programs that require double or triple staffing. We are lucky if we have one person on in some of those situations. That means limiting intakes, in that case, to residential programs as a result. We have managers throughout our service system covering shifts, covering overnight shifts, all the way up to top management. And they are spread thin across multiple and competing demands. In our outpatient clinics, the way the public would see it is somebody who calls for an intake for a behavioral health service, either therapy or medication, would be oftentimes would be put on a waiting list, would not be able to get in for treatment as quickly as they need to be. And the same thing with hiring and placing therapists in many of the schools throughout Connecticut, that we would not be able to see as many children as need help right now. And that is going to continue to be an issue for quite some time to come. We are all in such a hole with the number of vacancies we have and the lack of credentialed staff, particularly at that level, that it will, even if the demand for service levels off, the number of vacancies is so great that it's going to take a good 2 years to catch up with that. And that would assume that there's no more turnover, which is just not going to happen. So the level of crisis is extreme. And part of the impact of this is that managers who've been holding on, covering programs, covering shifts, doing triage in crisis teams and in outpatient clinics, they are getting so burnt out that we're going to start seeing greater turnover in that part of our workforce. And then we have to shrink our services and our service system. And that means many, many fewer people will get the services they need.
Okay, we have a question also from Representative Farrar of Connecticut. We appreciate her being here. She's asking how much nonprofit providers can see the stress of COVID on women and the impact of the lack of affordable and accessible childcare for families, and wondering if how folks would support childcare in the Build Back, excuse me, and how the support for childcare in the Build Back Better plan affect nonprofits. Anyone want to tackle that?
Sure. I mean, from our perspective, you know, we have a predominantly female workforce. We've tried to respond to this by providing immense flexibility with scheduling, with flexibility with, you know, as if somebody has a job where they can work from home, being 100 times more flexible than we ever were pre-pandemic. And I think that will be in place for many years. There's no question that we need a better childcare system in place. As somebody who was a working mother for many years, I know firsthand how critical that can be. And so we absolutely need to support that. And that's going to, you know, again, women are going to continue to make up the vast majority of our workforce. And all the things that go along with supporting women and families are critical to help then with individuals being able to work.
Yeah, being able to create regular shifts where people aren't frozen in, you know, is a challenge for anybody who has daycare. It's often cited to me as a concern for people either coming in or volunteering to take on an extra shift. The other thing I can tell you is that that is highly cited as a concern as we're deciding of what our hybrid return to work policy is going to be for our administrative team throughout all of those departments. That has been definitely cited as one of the major concerns.
Okay, thank you. There's a question in the chat. And from Brian Amaral from the Boston Globe for Tina Spears. He asked, the governor and legislative leaders have just this morning announced a commitment to act on Governor McKee's Rhode Island rebounds proposal, plus other federal funding. Have you been briefed on it, and how much of a difference will it make?
Thank you for that question. I have not been briefed on exactly what's in the details of the proposal. What I can say, and to support what Representative Kassar said, it's a step in the right direction. If there is funding that is going to stabilize something that has been significantly destabilized, that's a step in the right direction. What I can say is we have been advocating fiercely and for many, many months, if not years, on the critical nature of our workforce. So if this proposal and what the governor has proposed and the General Assembly is going to impact that significantly, we thank them for that. But I really don't have the details yet to know how significant of an impact it will have.
Yeah, and just what I would say is, no, I was not briefed about it. And I look forward to getting the details. But I think, as I said in my comments, this is we have some major structural issues, and the underinvestment as a result of ableism, ageism, sexism, and racism are still deeply embedded in the whole system. And I like to, or at least in this moment, the comparison that's coming to mind is when your roof is leaking, but then also the toilet overflows. Like, fixing the toilet overflowing doesn't stop the crisis in the house. And I think that's very much where we are. We are at a significant crisis point. We've seen the leaks coming for years from the roof, and it's, we've got a lot to do to make it a stable foundation.
Thanks. Christine Stewart asks, aside from ARPA funds, what can state lawmakers do? And I think that's kind of a question directed both at legislators, but also at the executive branch that has a lot to say about the ARPA distribution.
One thing I'll just jump in with a really quick comment is pay attention to who's on your committees. Talk to the people on your committees. The Finance Committee, the House and Senate Finance Committee, those are the people who need to know. There are Health and Human Services subcommittees, and those are fabulous, but they're not everybody. So really understand, when it gets down to it, we have large chambers with lots of people in them, but a small number of people get the appropriations bills through the pipeline. Figure out who they are and how to get some influence there.
I think in Connecticut, ARPA is just one piece of the picture. The state has an enormous surplus. It's got a rainy day fund that's full at $3.5 billion. It has an operating surplus that not only is an operating surplus for the regular budget, but would lapse funding into paying long-term debt. This is the time that the state has the ability to make the kinds of commitments to the nonprofit sector that Senator Austin, Representative Walker, and other folks have been pushing for. We're heartened by the number of Connecticut legislators that have been on this call, and we appreciate their support. And we're hoping that we can work with them over the next few months to get that commitment, not just from the legislature, but also from the executive branch. And we're looking forward to working together. I think folks understand this is a very serious problem.
Yeah, John Carl, if I can jump in. I mean, one of the one of the things that we did here in Massachusetts a few years ago is to provide data. We found that many of the people that we were trying to influence would only be motivated by numbers. They sort of looked at our sector as, oh, you guys are just whining, everybody is in that shape. And so it was important for us to provide real hard data that could not be disputed. And we had the UMass Donahue Institute, which is well respected here in Massachusetts, put data together, and it showed things that quite frankly we weren't aware of. That over 80% of our workforce were women, and that Massachusetts human services sector had a higher percentage of people who are working below 150% of the poverty level than in all other Massachusetts residents. And so we had to use those numbers as a way of saying, this is not just somebody whining. What you're doing right now is discriminating against people. You have a system that is creating these and perpetuating these inequities in not only women pay, but also in the pay for people of color, because we also showed the higher percentage of people who are either Black, Latinx, and quite frankly, also people with disabilities in the human services sector, or a higher proportion of them in our sector as well. So I think one of the things to think about is to see if in your state you can put some numbers together. Now, that doesn't mean that it's going to move those who are just resistant, but it helps deal with some of the resistance that you get about, well, what makes you guys any different than anyone else? The fact of the matter is we are disproportionately affecting women and also people of color in our sector. And quite frankly, if we're not uncomfortable about it, we should be ashamed about that here in our sector.
Agree.
One of the anonymous questioners brings up a way to bridge the gap is to privatize state services and move jobs and money from the public to the nonprofit center. That is something we've been talking about in Connecticut for the past few years. It made some progress in earlier years. That seems to have slowed or come to a halt. But clearly, it's a way for the state to take advantage of a nonprofit sector that provides quality services. In the context of, and this is unique to Connecticut, a retirement wave that is expected to take as many as 5,000 from the 45 or 50,000 state employees off the state full-time books. And it is an opportunity for the state to start from scratch and to rebuild. Tina?
Yeah, I just wanted to comment on that. One of the things in Rhode Island is we do have a public system and a private system that cuts across many of our interests. The one thing that we have done here in Rhode Island is we have worked collaboratively with the public and the private sector. I think there is more work than enough to go around. And what we don't want to do here in Rhode Island is to set up or draw a line between those two sectors, because I think they're equally valuable. I understand that there's difference in cost centers. There's different factors for why you would have public or private. But what I would say is we should be working together here in Rhode Island, or we are working together. There is no need for us to change that dynamic here in Rhode Island as it is today. But in the future, that may change. But for me, I wanted to put it out there very publicly that we in the private community work closely with our public sector to make sure they're stable as well as we are.
We have another question in the Q&A list. It talks about Beth Fisher having mentioned that temporary services are a bit of a stopgap to cover job functions, but also as the rates charged are high. The question is that the higher pay rates are passed through to the agencies, adding costs, but also serves an incentive for workers to leave positions to work as temps for higher pay. Has this happened, and how much has the spiral added to the problem, if at all? Seems like not. It doesn't seem to be something that's popped up a lot unless someone has heard it. Is that maybe all the questions? Is there anything in the chat that I haven't seen on the question list?
There's a question in the chat from Dan Kerwin saying he's extremely grateful for the critical need for competitive wages being discussed. Is there someone on the panel who can also speak to the need for overall funding in general, things like health insurance, rent, technology, unfunded mandates, et cetera?
I'm
go
happy
ahead,
to,
Barry. Yep, go ahead.
happy to pipe in on that one. You know, if 80% of our budget is, you know, personnel costs, it still leaves 20% of our budget that is not personnel costs and is, you know, the infrastructure that we need to be running our business. And so I know I mentioned in my previous remarks, you know, just the cost of oil, gas, electricity, technology, but, you know, workers' comp and, you know, all of the insurances, you know, all of those things are, you know, often in my tenure left out of the increases that are considered. In the past 20 years, we've received 2 increases. Both of them have been predominantly directed at wages only. And, you know, this last time it was heavily skewed to DSP wages only. And so, you know, that creates wage compression and all the other things that are needed in order for us to run a business, remain Medicaid compliant, you know, meet the requirements of our accreditation process. All of those things are highly challenged when just general rates and the rate increases aren't passed on to us as a component of the specialty healthcare that we provide. And so, you know, that to me is what we've been saying. You know, legislators know what the problem is. They know what the solution is. And yet, you know, we hope that they will choose to act and actually treat us as meaningful partners with the state and allow us to have good, solid businesses that provide good, solid wages for the people that we serve and provide the needed care. You know, like I said in my statement, we have shut down group homes. We are not taking admissions. People are waiting in hospitals to get services because the rates have not allowed us to run the businesses the way we need.
Tina?
Sure, I just wanted to build on that. And I've often thought about this as providers. You know, we are businesses and we are also in the business of humans, right? So we don't sell ourselves in the same manner that maybe other industries do. But when the state purchases from other businesses, when they purchase services, they very rarely take a look at, well, your cost center is disproportionate. You shouldn't be paying for that kind of benefit package. Your cost of your utilities and your rent, and it's questioned. And I think we have to ask ourselves, we have the same valid concerns in business dynamics that any other industry does. Yet we are questioned about the value of that. And it's critical to our success and our ability to operate in our communities. So I think we do have to have that conversation and really talk about why are we being questioned for the same cost centers and the same realities of our economies that other industries are not being questioned about. And I think we need to be strong and firm on that and represent our interests in those areas because they're the same as any other business industry, but we just have to make sure that we're communicating that effectively to our legislators. I will say that from Rhode Island.
Yeah, and if I might, Tina, the follow-up for that on me is legislators often tell us to fundraise for the difference. And, you know, talking about other businesses, they wouldn't contract with a bridge builder and say, you know, build that bridge 90% and go fundraise to finish the bridge. And what legislator wants to drive across that bridge. So, you know, they need to treat us as valued partners.
Michael?
Yeah, I was just going to jump in. That is so true. We had for over 25 years, our legislature would provide once in a while a salary reserve, which was money that's to go directly to the lowest paid workers. It was welcomed, it was needed, but it was not money that would provide real support for the programs that were needed. And we had convinced the legislature and the governor's office to do a financial health report of human services. And what that financial health report did was really show for some the numbers about how many of our organizations were, perhaps less than 30 days could be out of business. So if there was a hiccup in the economy, they were gone. And how many of those had cumulative deficits just on their business with the state. And for that, we use that as a way of putting through legislation that we call Chapter 257, which was done in 2008. And really, that was the first time that the state was forced to really look at all the costs that are associated with paying the salary, paying for human services in terms of building in the rates. Now, it's not perfect. There was ways around it, and there's still some things that are not quite perfect with it, and we're working on it, as Diane and Chris know, with really getting into a little bit of the weeds about what standards to be used and how are they going to get there. But heretofore, it was pretty much a whim of whatever they felt. I mean, essentially what we call it, they back into the numbers, right? They say, okay, well, this is what we have. So we'll figure out a rate that provides the same service based on what we have, rather than what does it cost to provide that service, knowing that, that group home is going to need utilities, it's going to need health insurance is going to be needed. You're going to have transportation costs. Oh, you just added a new mandate now about federal medical leave that needs to be in part, or state medical leave. How does all of that get factored in? And so we have a process now that rates are supposedly reviewed every 2 years for services under Chapter 257. So it's a framework, but it's not perfect. And I'm sure my providers will agree with me on this. We're working with them actively to continue to move and push that forward. Because yeah, it was much easier at some point to say, well, we're going to take care of the low paid people. And I think, part of what happened during the deinstitutionalization movement, if I may just add this, a few years ago, I think it was oversold on it's going to cost less than state. I think that's all people really paid attention to. It's going to cost less. And that's what they factor in, because some folks say to it, well, aren't you supposed to cost less than what we pay state employees and state government? So we still have to unravel some of that stuff, which is really unfortunate, but we have to push that along and explain that for the most part, the only difference between what the government and what your private sector and what our sector is probably the profit, whether there's a profit involved in it or not. But we still have all the other costs associated in providing quality care. So I'll just stop right there. But that is a major issue and concern, is to not have money just go to salaries. And really, that's one of the things we proposed, in making sure it's the rate that's being addressed.
Thank you, Michael. We have to wrap up. I do want to say, I don't think anyone could have sat through this today without understanding that the combination of years of inadequate funding, even when there's been recent increases, and steadily increasing demands, and the severe continuing pandemic have combined to point up with what somebody on the panel called the fragility of the system. And let's be clear, the system is throughout the region cracking. David Thompson from the National Council of Nonprofits had sent a message quoting someone else as saying, there's no recovery without childcare. And I think that is true, but it's also true of the entire nonprofit sector. There's no recovery from this pandemic and this economic period we've had without the nonprofit center. And so our message to each of you today, if you're someone who's in communications, please let people know about what you heard today. Talk about it. If you're a provider, keep standing together. You're sending the message about how your needs affect the residents of each of your states. And if you're a legislator who is here, you are almost certainly our ally, and we appreciate you being here, and we appeal to you. Hope that you will take this fight to your colleagues and to the executive branches. We need your help, and there truly is no recovery without every one of our residents who are in need getting the services they depend on. And I think we've heard today a lot about the problems that we have in this region providing those services. So thank you all very much for coming today. Thank you to our panelists. Thanks to my colleagues in Massachusetts and Rhode Island. And good luck. I hope we can continue to work together.